Good day, everyone. Today we'll talk about quality assurance, or QA, in the hemodialysis setting. In healthcare, quality isn't just about doing our jobs. It's about ensuring every process, every machine, and every team member contributes to safe, effective, and ethical patient care. Quality assurance is the backbone of a dialysis facility. It ensures our patients receive treatment that's not only effective, but also consistent and compliant with standards. Quality assurance is a systematic process of monitoring, evaluating, and improving the quality of services to ensure patient safety and clinical effectiveness. The key message is that quality assurance is proactive, meaning prevention-focused, not just reactive, meaning problem-solving. Hemodialysis is one of the most high-risk outpatient procedures. We deal with blood, water, chemicals, and vulnerable patients several times per week. Even a small deviation, from water quality to dialysate composition, can cause catastrophic harm. That's why QA ensures that what we plan, we actually do, and what we do, we continuously improve. Quality assurance matters because it protects patients and ensures effective dialysis. First, patient safety. It prevents infections, contamination, and prescription errors. Second, treatment effectiveness. It keeps URR and KT over V consistent, meaning patients get the right dose every time. Third, regulatory compliance. It helps us meet DOH, PhilHealth, and accreditation standards. And fourth, operational efficiency. It reduces waste, downtime, and errors. Let's organize QA into 4 main pillars, each representing a critical component of safe dialysis practice. 1. Water quality and dialysate safety. Includes monitoring of RO water, endotoxin, and microbial counts, regular loop disinfection, and ETRF filter integrity tests, TDS, conductivity, and pH monitoring, documentation and corrective action when parameters exceed limits. 2. Machine performance and maintenance. Includes calibration and preventive maintenance schedules, daily checks of alarms, conductivity, temperature, and pressure limits, and monthly technical QA reports. 3. Infection control and staff practice. Includes hand hygiene audits, aseptic technique in vascular access handling, surveillance of CRBSI, HBV and HCV seroconversions, and pyrogenic reactions, and regular infection control committee reviews. 4th, clinical outcomes and documentation, such as but not limited to the following: dialysis adequacy, URR greater than 65%, KT over V greater than or equal to 1.2. Anemia management, hemoglobin 10 to 11.5 grams per deciliter. Nutrition, albumin greater than or equal to 3.5 grams per deciliter. Calcium, 8 to 10 milligrams per deciliter, and avoid hypercalcemia. Phosphorus, less than 5.5 milligrams per deciliter. Blood pressure control, and monthly QA summary reports and trend analysis. Each pillar supports the others, creating a safe and effective dialysis environment. Quality assurance is a continuous process. The PDCA cycle, plan, do, check, act, helps us maintain high standards. We plan by setting objectives and standards. We do by implementing those standards in daily practice. We check through audits and monitoring indicators. And we act by making corrections and improvements based on what we find. This cycle repeats continuously to ensure sustained quality. Here are examples of quantifiable indicators used to measure quality in dialysis units. How do we measure quality? Through key indicators. For example, we monitor dialysis adequacy with KT over V, aiming for at least 1.2 in most patients. Hemoglobin should be maintained between 10 and 11.5 grams per deciliter. Water quality is tracked by endotoxin levels, which must remain below 0.25 EU per milliliter. We also track infections, like catheter-related bloodstream infections, keeping them below 1.5 per 1,000 catheter days. And finally, preventive maintenance compliance should exceed 90%. By monitoring these indicators, we can ensure patient safety and treatment effectiveness. QA relies on documentation. If it's not written, it didn't happen. Routine audits include technical audit, machine logs, conductivity records, water system audit, RO, endotoxin, microbial results, infection control audit, PP use, Disinfection procedures. Chart audit. Completeness and accuracy of medical records. All findings are reviewed monthly by the medical director. Quality assurance is a team effort. The medical director ensures medical standards are met. The nurse manager oversees implementation and training. Reuse technician maintains water system and equipment, and all staff are responsible for daily compliance. Quality is everyone's responsibility. Quality assurance in hemodialysis is not a task, it's a culture. Each of us plays a part in ensuring that patients not only survive dialysis, but live better because of it. Remember, what gets measured gets improved, and what gets improved saves lives.